There's a serious crisis making headline news in every home in America. We see it daily on the television, on the internet, and hear about it for hours on the radio. Healthcare costs are rising. The system has gotten so complicated you can no longer get through without sacrificing time or money. Today, families turn to their caregiver or the person in their family burdened with managing everyone's schedule, trying to figure costs and find a doctor or remedy for the need at hand. The caregiver is typically the busiest person in the family, getting up early to get the kids ready for school, dropping them off before work, scheduling their after-school activities, stopping by the grocery store to have something ready for dinner, and if there's enough time, fixing that leaky faucet. The next day starts the rush all over again for the caregiver. What happens when a sick child or a sick parent gets thrown in the mix, or an unexpected medical bill, or the need for a major surgery? Where does the caregiver find the time to become an expert in healthcare? It's unlikely the caregiver can handle every healthcare situation, and they shouldn't have to. That's why we're excited to introduce GHCNow.
Well, I needed a crown. I went to Global Health Care Now, and I said I lived in Arlington. I said, okay. So anyway, they found a dentist close to my house. It's just around the corner. Very nice office, beautiful office. The service is very fast and very efficient, and you know exactly, when you go to the doctor, you know exactly what you're paying, exactly. And I'm saying, I had insurance the last time, and it cost me $2,650. I have Global Health Care now, and it's $997, and I'm going to tell you, that is like the greatest thing. And they did a perfect job. I mean, they did even a better job than the other dentist did.
I've been wanting LASIK for a couple of years now, so I've been researching it and everything. So I learned that people leave the country for surgery. So I went online to research medical tourism, found Medical Tourism Connection, and I told them I wanted LASIK. And so they gave me some option, and I chose the doctor. And that operation was not painful or scary. It was quick. It was very quick. On day 2 of the operation, I would say it was a success. Oh, the doctor was beyond what I expected. He was perfect. I'd come to him again and again. Everything that happened is what I expected. Recommending this experience to a friend, I would definitely do that.
The problem is a lot of people don't know how to navigate through the process, and so Global Healthcare is a turnkey solution. I mean, from A to Z. Having a resource like that is huge because you see the cost saving.
Who is GHCNow? GHCNow is not ordinary like insurance or a discount card. GHCNow is 100% true access to care. Did you know the healthcare industry costs $2.5 trillion every year? Where does that money come from? Unfortunately, it comes out of each American's pocket, from you, families, and others just like you. Now, something else you may not know is that billions of those dollars are spent needlessly every year. That's wasting a lot of your time and money. And because the healthcare system is getting so increasingly complicated, it can even be harmful to people. Wow. So because it's getting so increasingly complicated, expensive, and time-consuming to see a doctor, run a test, or make an appointment, GHCNow gives you options to reduce your exposure by taking you direct and changes all of that. In fact, the healthcare system has around 192 moving parts. That's almost as many bones as there are in the human body. So because of your constant contact with the healthcare system, GHCNow designed a better way, a way that's not so very complicated. Here's how it works. You're going to pay for something healthcare. Instead of going through the complicated system you don't understand and could harm you financially and physically, you go through GHCNow's system, a better system, a system that connects you to what you need without all the things you don't. You see, wasting time and money on things you need when you don't have to just doesn't make sense. GHCNow does not work like insurance. Insurance companies have to finance future expenses, maintain a profit for their shareholders, and therefore customers end up paying high premiums every month. Individuals with pre-existing conditions aren't even accepted, and the care can depend on what makes financial sense to the insurance company. This means millions may be foregoing care, getting lesser care, and paying more for care. GHCNow does not like these restrictions. In fact, GHCNow accepts everyone and helps make sure you pay only for what you use when it comes to the healthcare you and your family need. The problem does not stop with insurance. GHCNow is designed within your high deductible insurance to get you the greatest value from your healthcare dollar. GHCNow knows many people manage healthcare on their own, trying to figure it out along the way with extreme difficulty or using discount programs with limited providers. Many times, people on their own say this can be confusing and difficult for them and the doctor's office, leaving both frustrated and embarrassed. GHCNow helps people manage and takes a hands-on approach so both the member and provider know the true cost and what to expect. So, unlike insurance or discount cards, GHCNow believes that you should never be limited to healthcare choices and should always get the best care that fits you. The fact is, everyone can have an overpriced bill. 9 out of 10 hospital bills are incorrectly coded, and that doesn't harm just you, but your entire family. GHCNow knows you can easily be overcharged without knowing it, even for a typical office visit, and that Americans overpay by more than $10 billion every year into the healthcare system. Nobody is immune. The entire population of the US can be subject to this loss. That's over 300 million people. GHCNow corrects this problem so a bad problem doesn't get worse. The final factor which separates GHCNow is that other programs are designed to fit into the broken system. GHCNow goes beyond this by taking what is normally complicated and uses a simpler approach for a better outcome. So why not give yourself a break and use something that is designed around you and not a broken system? GHCNow is above anything else healthcare in offering not only local but global access outside the US in one of the largest trends in affording healthcare. The best care, whether it's 3 miles away or 3,000 miles away. It even includes cosmetic and dental. So whether you want to pay only for what you use, would like to pay less every month for insurance, like extra help from overpaying, or want to save time with the convenience of someone on your side, GHCNow is the solution for you. You seek the most qualified team of experts to advise on financial interests. Why not your health?